Hi, good morning, Richard. My name is Adelaide Taylor. I'm your invigilator for the OET speaking session on the 5th of February 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you say your full name for the record, please?
My full name is Richard Finch.
And what is your candidate number, please?
My candidate number is 211202431.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What skills and attributes do you have that make you think you would be able to effectively lead a department?
As an RN, I have worked in many different kinds of environments. Some were cohesive, and the nurses worked together as one unit with many different parts that all reached the same goals. In others, it felt more like the different components, or nurses spent more time working against one another in a dysfunctional, broken device. I know what both feel and look like, and how to avoid dysfunction and build a cohesive unit for the department. I have the organizational skills, the attention to detail, and the communication skills to lead the department and to earn the respect and trust of all those who work under my supervision.
What is your plan to ensure that all your responsibilities are met?
Organizing is the key to do any job well done, and this is no exception. I will closely monitor all the tasks I have before me at any given time and conquer my list in order of most important. I will delegate as appropriate to ensure that all the tasks are accomplished when they should be. And this will allow me to put an appropriate amount of time towards patient care. The administrative part of this position is incredibly important to be able to ensure patients are properly treated in the best environment. But patient care should always remain the top priority, as I am a nurse first and foremost.
What does being a mentor mean to you?
To me, a mentor is someone who can be looked up to and who will always have the answers that are being sought. As a charge nurse, I should have the clinical answers and knowledge to help my nurses make the right diagnoses. A mentor also provides emotional support through difficult times. These two attributes are the basis of all mentorships. And as a charge nurse, I will be able and willing to use my extensive knowledge and experience with teaching and guiding to help my nurses give their best every day.
How would you motivate your junior nurses on a daily basis?
Motivating my juniors would be something I do largely by example. I would be the first one to go the extra mile, taking the extra time with patients and doing all I could to be the best nurse I can be. Using individual encouragement, team meetings to discuss department needs, and the examples of the best nurses on the floor, I would help lift the other nurses to a higher level. I also understand that motivation usually has to come from within, so I would learn what my nurses need in order to succeed and help them find that motivation for themselves.
What great challenge do you expect to face?
I anticipate a situation where doctors don't cooperate with nurses that support them. When that happens, a lot of things can go wrong, from communication breakdown to wrong drug administration. But rest assured that I will handle the challenge effectively. I will ensure communication channels are up and running at all times. I will also promote an environment where physicians and nurses work together to offer quality services.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Hi, good morning. My name is Richard Finch. I'm the nurse in charge of the home. How may I help you today?
Hi, good morning. My name is Adelaide Taylor. I'm the daughter of Taylor Hemsworth.
Hello, Adelaide. Nice to meet you.
Nice to meet you too. Well, Richard, I have come to see you discuss my father's care.
Definitely, we can. With pleasure. Let me take his records, please.
Sure, you may please.
Now, you may ask me anything regarding your father's care.
Richard, many things bother me.
Certainly, you will be. I can understand that, Adelaide. Well, may I know what all things are bothering you?
Yes, I'm coming to it. Nurse, I think the tube which is kept for feeding is uncomfortable and my father might be finding it difficult.
Your concern is quite reasonable. Let me explain it to you, Adelaide. An esophageal tube, NG tube, is a special tube that carries food and medicine to the stomach through the nose. Following a stroke, swallowing can become unsafe. This could mean that when a patient eats and drinks, some of the food and fluids go into the airway instead of the stomach. This can cause chest infections or pneumonia or choking. Nasal tube fed prevents this. Hence it is being used.
I understand that. However, is there any other alternative to nasal tube feeding?
Don't worry, Adelaide. We are taking all the precautions and safety measures. We are also taking care that the patient is able to cope up with the tube. It is the best method possible for him because it can be removed whenever your father is ready for an oral feed. I hope you can understand.
Yes, I got you. Also, I have concerns about the need for a lifting machine and its safety.
Patients more likely to move around more. Mobility issues make it difficult for people to move around. Being lifted by other people is not comfortable. Patients can be placed in awkward positions, and it can hurt their dignity. It's not a good feeling being shifted around by others, but a patient lift can make it more comfortable and manageable. Moving or helping move a person with mobility issues can be extremely difficult. It places a lot of stress and strain on caregivers. A patient lift provides great support to the caregivers when helping to get out of bed, into the bath, and when moving throughout the home.
Yes, I understand its uses. But what about safety?
Yes, it's safer. Using a patient lift is inherently safer than relying on a caregiver to help make transitions. There is less of a chance of slipping, or having a fall, while using a lift to help the patient get in and out of bed, or the bathtub. You'll have peace of mind, knowing the odds of falling are greatly reduced. Isn't it, Adelaide?
Yes, it is.
I hope your concerns have been addressed and cleared by my briefing. Are you feeling much relieved now?
Yes, really. I am really relieved right now.
Is there anything I need to be addressed for you?
Nurse, I am worried about my father's privacy.
Definitely, privacy is a major concern. We respect the privacy of each patient. It's their right and we have the responsibility to protect it. We are doing our best as well. While toileting, bathing, and while changing dress we make sure that curtains are drawn and the doors shut. We maintain proper decorum, Adelaide. And there is no room to get worried.
All right, great to hear that.
Being a daughter, I can truly understand your situation. It's quite natural. I hope I have cleared all your concerns.
Yes, nurse. Thank you for your time and effort to convey information in the best way.
I am very pleased to hear that, Adelaide.
That is the end of your OIT speaking role play. All the very best.
Thank you.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.